Hello everyone. So we have Dr. ANIRBAN with us. He has scored a rank 1 in INICET exam November 22. So ANIRBAN, tell me about your preparation strategy. How did you prepare and what were your sources?
So, regarding my preparation, I had started my preparation just back in my UG from third year. So third year I joined DAMS, but at that time we had offline classes. So I was not that very regular with the DAMS classes, but definitely for the major subjects of third year like ENT and PSM, I tried to follow DAMS and had written notes of that. And for subjects which I missed, I had started preparing also from Marrow videos. But then the lockdown came, so my major preparation source was obviously Marrow at that point of time. And I had become so comfortable with Marrow, so I continued with Marrow even throughout my internship and post internship. Regarding MCQs, I had started preparing them from around internship. So internship in our college, my UG college, JIPMER, was very hectic. So our usual 6 months of internship of medicine, surgery, OG, I barely got time. But I usually took out 30 minutes to 1 hour to practice MCQs every day, varying from the 24-hour duty days. So a
Great.
consistent habit of MCQs is very important from the very beginning of internship, or maybe even better if you start from your third. So, and regarding GTs, I had started giving GTs from the later half of internship, and at initially when my preparation was like not very much on the track, I still gave GTs even though I got ranks in thousands. But I knew that I could do better, and since I was a very good student right from the beginning of MBBS, I knew I had my basics clear. So I had to just consolidate and whatever I had read and I had to just practice MCQs and give GTs. So for all the students there are two types of students. One like me who read a lot during MBBS, and other lot who read a lot after or during internship to crack the PG exams. So the strategies differ for them. For people who have a good base, practicing MCQs and giving GPs is of paramount importance. But for people who have read a bit lesser during their MBBS years and have started in internship or after that, I think the first revision is more important than the first reading. So your first revision will tell you how much you lack in certain subjects, which are your weaker subjects and which are your stronger subjects. Even for like INICET, an exam which like in the first INICET, I had not like prepared like for 2 months. I was off preparation because it was my surgery posting just 1 month before, and I had completed internship just 20 days before the INICET exam. So in those 20 days, I had just read few topics in like hot topics in PATH and OG and PSM. But in that exam, in which I got a rank of 283, many questions came from genetics and their immunology and microbiology, virology, parasitology. So regarding to INICET, there is a, very core set of topics which should come, and there are PYTs, the previous year topics which are repeated. People tend to mug up all the previous year questions, but they are not as important as the topics. So there are a very like certain list of topics which are very key to the preparation of INICET, and you have to like read them, and you will get 40 to 50% out of the all from those topics. Rest your preparation will be same as NEET. And for NEET, the quantity of and the vastness of your preparation will matter before the exam. So the better you revise, the more topics you will be able to encompass in the last 7 days. For any exam, the last 7 days matters. And for me, because I got a seat in like KEM in the NEET PG, but I knew I could have done better. So I left the seat, and the last 4 weeks or 3 weeks of the preparation was of very much importance to me, and it will hold true for any person. Even if you have not read for the entire internship, if you read even like two subjects like surgery and OG, which will give you 50 questions in NEET, 40 to 50 questions, you will stand at a much better position than a person who has not strategized. So strategy is very important for any exam. So what I feel is you have to revise your weaker and volatile subjects in the last 1 or 2 days, and the stronger and the more covered represented portions in the last 7 days. So this is how you will score better in your exam. But just reading, just doing those subjects won't help in the last 7 days. To consolidate them, you have like a months of preparation behind that. But I am telling you how you can get the best out of yourself in the last 7 to 10 days, where people tend to strangle and people tend to miss out on their potential. So yes, this is what I want to like. The crux of my preparation was the last 3 to 4 weeks of the preparation, in which I could optimize my strategy.
Great, great, Anirban. So, what I heard was that you also used to get like rank in thousands in GT. So that's what I want to tell everyone, that even if you are getting rank in thousand, you can still get a good rank. Just keep on revising and keep on giving your GTs. Any
Yes.
tip you want to give to aspirants that they can apply in the last 2 months of their exam?
So for the last 2 months, three things are very important. Is to one, having belief on yourself. You might not have read a lot during the previous months, or whatever might have been the issue with your preparation, but the last 2 to 1 month will define. If with your present preparation you are supposing you are getting a rank of 10,000, with the last 2 months you can bring it easily to less than 1,000. Or if you are stuck in the 500 to thousands, you can easily get it down to 100 if you strategize on the last 2 months of preparation, or last 1 month is very important. So what one should do before in the last few months is that you should in the last second month, you should always go for the stronger subjects, the whichever subjects maybe you have read more in final year or second year. You should consolidate on that. And you should have a bare understanding. You should have a revision of the MCQs of the weaker subjects, because you don't have time to read all of them. But from the previous year questions and from the bookmark questions, or whichever modules you have solved in your weaker subjects, like for me, my first year and third year were weaker. So in the NEET exam, I had tried to solve most of the MCQs of them, even though I had not done the first reading at that point. So solving the MCQs is very important to get a hold of what questions can come from those weaker subjects. And regarding to stronger subjects, you should consolidate on them uh, before the final month of exam. And in the final month, you should like consolidate and more on the volatile parts, and on the subjects which are more represented, like surgery, OG, PSM in NEET are very much represented, and they will constitute 60 to 80 questions. And coming to like minor subjects like SAT subjects and orthopedics, they are the like kingmakers. So you should have a very good, for those who want to get a top rank, those who are stuck at 100 to 200, maybe some subjects like ENT or eye or ortho or pediatrics, which is much less asked in the exams, they might be the game changers. So uh, coming to the nitty-gritties is also very important for those who are stuck in mid ranks. So this is how people of every rank can benefit from, like, my advice. I feel you have to strategize on your weaknesses, and you have to believe in your strengths. That is the gist of what I have wanted to say.
Very well said, Nirvan. So, all the best for your future journey in AIMS. We'll meet soon.
Yes, sir. Thank you.